Okay, let's start now. This revision will be recorded. I'll make all of you mute, and then if you want to ask about anything at any time, please open your mic and ask about it. Okay. Sorry for this interruption, but let's start. Okay, let's start. Firstly, I would like to welcome all of you in this revision, the revision for KAPS exam, March 2023. We have different types of lectures. Let me firstly show you the schedule of the revision, then we will start directly. We have 9 lectures in this revision. 5 of them are free, like today's lecture, and 4 are full revision. The 5 free revision contain about average of 20 to 25 questions. Questions from the previous exams. Full questions with full choices. And we will explain what we will choose. What is the best answer? What is the right answer? Okay. Also, we will explain some points related to the question. And if the question change in the exam or giving another question with similar idea, we will be ready for this. We will be ready to solve the question like what we discussed. Okay. So those will be the 5 free revisions. This will be the first one today, and I will announce about the coming lectures later on. The 4 full revisions. 4 full revisions also contains questions from the previous exam, especially the most recent exams. The structure of these 4 lectures, each of them contain about 120 MCQ. Also from the previous exams. Also from the last exam and the previous one from 2 to 3 years ago. Okay, so they are very important to know the questions of the KAPS exam. Also, we will discuss the question with the answer and the rationale of the answer, plus if there is any note related to the question, we will explain it. The first one in this 4 revision regarding to revision of paper 1. The second one is revision of paper 2. The third one is revision of mixed questions related to paper 1 and paper 2. And the fourth one is most recent recalls from the last exam, which was present in the last November 2023 exam. This will be the structure of the full revision. And at the end, we have mock test. This mock test is mimic the real exam, similar to the real exam, with two papers, paper 1 and paper 2. Each of them contain 100 questions, should be solved in 2 hours per each paper. Okay, so this will help you to be ready for the real exam. Let's start our lecture. As I mentioned, I will make all of you mute, and if you have any question at any time, please open your mic and ask directly. Okay? The first question today. What is the name of the heterocyclic organic compound present in primacane? Here, he gives you this structure and ask about what is the name of this heterocyclic ring. For sure, this question related to paper 1 because it is related to the chemistry. Okay, so let us know what is this ring. Is it quinoline ring, isoquinoline ring, pyridazole ring, or indole ring? This ring is quinoline ring. It is the ring of primacane. Also, it is the ring of quinine and quinidine, the antiarrhythmic, antimalarial agents. Also, it is the ring of hydroxychloroquine, plus it is the ring of quinolone antibiotics, ciprofloxacin, levofloxacin, and other respiratory quinolones and fluoroquinolones. Okay, all of those, I call them Q group. Why? All of them starting with the letter Q. And any drug of them having the quinoline ring will cause, or you can expect this side effect. What is the side effect? QT prolongation. Okay, so you can expect QT prolongation from this ring or from any drug containing this ring. While, what is the isoquinoline? Isoquinoline here, the difference between isoquinoline and quinoline is this, or the location of the nitrogen. Nitrogen in isoquinoline present here. Okay, what about the indole ring? Indole ring, here we have 5-member ring, not 6-member ring. This is the indole ring. Let us see the second question. The most appropriate, any question having this word, the most appropriate, please pay your attention to this question. Why? Because the vast majority of the questions containing this word may have 2 or more than 2 right statements. But here he needs you to choose the best or the most appropriate. So you should read all the statements, all the choices very well, and you should be careful in your choice. Let us see this one. The most appropriate action in the combination between daunorubicin and amiodarone. Let us firstly see what is the daunorubicin and what is the amiodarone. Daunorubicin, it is one of the chemotherapeutic agents related to anthracyclines or rubicin family, which may lead, what is the side effect of it? The main or the most common side effect of it is cardiac toxicity. Okay, so we should put this in our mind. Amiodarone, what is the amiodarone? It is one of the class 3 anti-arrhythmic agents. Class 3 anti-arrhythmic agents. So here we have some expectation about the interaction. One drug causing a decrease in the rhythm of the heart, and one of them may lead to cardiac toxicity. So we can expect an effect on the heart or a harmful effect on the heart when we combine these two drugs. Let us see the choices and choose the right answer here. This interaction can lead to prolongation of QT interval and sudden death. Maybe. This interaction can lead to decrease the efficacy of the daunorubicin as a chemotherapeutic agents. It's wrong. Why? Firstly, you should know that the amiodarone is inhibitor to the cytochrome 3A4. So, if the interaction through the cytochrome, therefore, here we can expect an increase in the effect of daunorubicin, not decrease. So, this answer is wrong. This interaction can lead to decrease the effect of amiodarone as antiarrhythmic. Also, this statement is wrong. This interaction is of no significant risk. Okay, so the best one here is the first one. This interaction will prolongate the QT interval so that it will lead to serious side effects, which is QT prolongation and may lead to death. Sorry. Okay. Let us see the next question. Which has the fastest blood flow? Here, we are talking about one of the factors that increase the blood flow, which is the diameter of the blood vessel. As the diameter increases, so we have vasodilation, or not vasodilation specifically, but larger blood vessel, so the blood flow will be faster. Regarding to those choices, venules, capillaries, veins, and arteries, we'll find that the arteries have the wider diameter, therefore the fastest blood flow will be there in the arteries. Okay, this one also is one of the questions of the previous exams. Amiodarone again is metabolized by which cytochrome? Cytochrome 3A4, cytochrome 2A1, 2C9, 2C19. For amiodarone, it is metabolized by the cytochrome 3A4. Unfortunately, you should know the cytochromes very well. You should memorize the substrates, inducers, and inhibitors for most of the cytochromes, or whatever. You should memorize them. What is the difference between the word substrate, inducer, and inhibitor? This is the enzyme. Substrate to enzyme means that the drug that interact with the enzyme or need this enzyme to be metabolized. Need the enzyme to be metabolized. So when we mention that the amiodarone is metabolized by cytochrome 3A4, this means that amiodarone is a substrate to cytochrome 3A4. What is the meaning of inducer? Inducer means increase activity of the enzyme. Okay, so when we interact between the inducer and substrate, what will happen? Inducer will decrease the level of the substrate. Inducer decrease the level of substrate. if they are interacting with the same enzyme. To remember that, inducer with D, decrease with D. Okay? While inhibitor will decrease the activity of the enzyme. What will happen after that? The enzyme activity to metabolize the substrate will decrease so that the substrate level will increase. So inhibitor will increase the level of substrate. Okay? From those statements, you can generate another statements which are important. Important to remember. What are those statements? Decrease the level of substrate equal increase its metabolism. And if you increase the metabolism of any drug, you will increase its clearance. And so that the T-half will decrease. So those statements are equal to decrease the level or equal to the word inducer. If you remember this, you will answer any question related to this type of interactions. Okay? While inhibitor increase the level of substrate. So what are the statements that equal to this? Increase the level means decrease metabolism. Decrease the clearance. And increase the T-half. Okay? Again, if you have any question, please open your mic and ask about it. Let us see this one. Which of the following vaccine do not cause active immunity? Before answering this question, let us understand what is the meaning of active immunity and what is the difference between active and passive immunity. Active and passive. The word active and passive similar to when you eat a diet, any diet or any food. Your body will start to digest this food, digest the component of the food, digest the carbohydrates, digest the fats and lipids, okay, with the digestive enzymes. Why? If you give the body directly the main components, you give the body glucose or fatty acids or amino acids. Does the body start to digest it? No. They will be already digested. Here, the difference between active and passive. Passive like digested food. Okay, what is the meaning of that? You will give the antibodies directly. You will give the antibodies directly to the patient or to the human being. So that the patient here or the person here will not generate any immunity. He will have directly the immunity without preparation of them or synthesis of them. This is the passive. So that the immunoglobulin any vaccine as an immunoglobulin or called immunoglobulin, it is passive. While the active, the body starts to generate its own immune system. You will give him a part of the virus or the infection or detoxified toxins, whatever, so that the body start to generate its own immunity, start to form the antibodies. Here it's like normal food, start to digest it. Here, start to generate its own immunity. So any vaccine or toxoid, they are active. Okay, now we have the ability to choose the right answer. Human hepatitis B immunoglobulin, directly, it is not active. It is passive. So this is the right answer. Live attenuated influenza vaccine, MMR vaccine, polio vaccine. So all of them are active except the hepatitis or human hepatitis B immunoglobulin. It is a passive one. Ion exchange resin is used for all except. What are the ion exchange resin? They are a group of drugs that absorb other components, either drugs or metals, and prevent their absorption. We can use ion exchange resin in different therapeutic uses. One of them is to remove the toxicity before its absorption. Another use as antihyperlipidemic agents like cholestyramine. Another use in diabetes. Okay. So also it can decrease the absorption of some metals and electrolytes like potassium. So what are the uses? Lowering LDL, yes. Prevent reabsorption of bile acid, also, yes. Management of hyperkalemia, yes. Management of toxicity of some drugs, yes. But prevention of formation of kidney stones, it is not of the uses, not one of the uses of this agent, the ion exchange resin. We have some examples like cholecystol, cholestyramine. Those are ion exchange resin. Please pay your attention with me in this question, because here we have some relations between ions in our body. One of them will affect the other. Also, some relationship between some hormones and those ions. Hypophosphatemia means that there is a decrease in level of phosphate. Refers rise in. So, what is the direct effect that leads to hypophosphatemia? If you look into the choices, calcium level, vitamin D, thyroid hormone, potassium level. The only one that does not affect the phosphate level is the potassium. So we exclude this choice. But others will affect the phosphate level. Others will affect the phosphate level. How? One of them having a direct effect, and this is what we're looking for. And other two have indirect effects. Let us see. The ion that affect the phosphate level directly or affected by phosphate level also is the calcium. We have an opposite relationship between calcium and phosphate. As calcium increase, phosphate will decrease. And as calcium decrease, phosphate will increase, and vice versa. As phosphate increase, calcium will decrease. And as phosphate decrease, the calcium will increase. Why? Because they form a chelate with each other. Chelate or complex with each other. So one of them will capture the other from the bloodstream and affecting its level. Therefore, when we have hypophosphatemia, the first thing that may lead to this is calcium level. Here we have an increase in calcium level. Okay, what is the relation with vitamin D and thyroid hormone? Vitamin D is one of the vitamins that affecting calcium level. How? by three main mechanisms: increasing absorption from GIT, increasing reabsorption from renal tubules, increasing resorption from bones. At the end, the calcium level will increase so that phosphate level will decrease. Thyroid hormone, what is the relation? It is completely indirect relation. Thyroid hormone from the thyroid gland. We have another gland related to the thyroid gland, which is parathyroid gland. Parathyroid gland. When the thyroid hormones increased, parathyroid hormone also increased. So what? Parathyroid hormone, its action like vitamin D. So it will lead to three actions: increase absorption of calcium from GIT, increase reabsorption of calcium from kidney tubules, and increase resorption of calcium from bones. As a result, calcium level will increase and phosphate level will decrease. So all of them will affecting phosphate level, but which of them is the direct effect? It is calcium level, so that the right answer here is A. Okay? For this one, for this one, co-administration of furosemide. Co-administration of furosemide with digoxin. Okay. Here, what is the problem? The main problem here is the furosemide. Furosemide, one of the drugs that causing what for potassium level. Furosemide will deplete potassium level. It will deplete potassium level. So potassium level here will decrease, and there is an indirect relationship or opposite relationship, inverse relationship between potassium level and digoxin toxicity. As potassium increase, toxicity will decrease, and as potassium decrease, toxicity will increase. So here we have a problem with the toxicity of digoxin. There is an increase in digoxin toxicity due to hypokalemia. The same effect may happen with thiazide diuretics or any drug leading to hypokalemia. So we should restrict the combination between the digoxin and any drug causing hypokalemia. Okay. Let us see this one. Change of fungi from hyphae to yeast by temperature is called sporodization, dimorphism, germination, or sexual reproduction. This conversion from hyphae to yeast and the opposite is called dimorphism. This is the meaning of the dimorphism, is the conversion between the two forms of the fungi, from hyphae to yeast or from yeast to hyphae. The mechanism of action of lamivudine. Lamivudine is one of the antiviral agents. Also, it is related to the heart. One of the heart drugs. Heart drugs, drugs used to treat human immunodeficiency virus. Okay, we have 20 drugs under the heart. Also, this lamivudine is the first line in treating hepatitis B virus. Okay, what is the mechanism of action of it? It is nucleoside reverse transcriptase inhibitor. How can we know the mechanism of action by an easy way? For heart drugs, we have, as I mentioned, we have 20 heart drugs. Those antiviral agents under 5 mechanisms of action. Nucleoside reverse transcriptase inhibitor. Non-nucleoside reverse transcriptase inhibitor. Nucleotide reverse transcriptase inhibitor. Okay. Protease inhibitor. And fusion inhibitor. Okay. Those 20 drugs classified under these 5 mechanisms of action. Let us start with the easiest 2. Under the nucleotide, we have tenofovir. We have tenofovir. To remember it, nucleotide with T and tenofovir for with T. Okay, so this is the nucleotide reverse transcriptase inhibitor. Fusion inhibitor. Fusion inhibitor, we have enfuviritide. Okay, fusion, FU, and enfuviritide with FU. Those are most easiest 2. Then, protease inhibitor, all of them ended by ver. 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 Like ritonavir, squanavir, indianavir. Okay. Except 2, except tenofovir, it is a nucleotide, and except abacavir. It is nucleoside reverse transcriptase inhibitor. Okay? So any drug ended by ver, you can expect that it is protease inhibitor firstly, but if it is tenofovir or abacavir, they are tenofovir nucleotide and abacavir is nucleoside reverse transcriptase inhibitor. The other nucleoside reverse transcriptase inhibitor, the family of vudine, like zidovudine, stavudine, and lamivudine, this one. So lamivudine is nucleoside reverse transcriptase inhibitor. Okay? The remaining, like FU variants, they will be non-nucleoside reverse transcriptase inhibitor. This will help you to remember the mechanism of action of those drugs. Let us see the next one. The most appropriate. Again, the most appropriate means one of the choices will be the best. Some of the choices may be right, but one of them is the best one. So focus on the choices. Read them carefully. The most appropriate action for patient on doxorubicin chemotherapy and physician prescribe him glucosamine to relieve his mild osteoarthritis symptoms. Here we need to know the action, not to need to know what happened or the interaction. What is your response in this case? Is your response to stop one of them, or increasing the dose of one of them, or replace one of them, or decreasing the dose of one of them? Whatever those are the actions, what you will do. Okay, so when he asks about your action or what is the action, this is the answer: either stop one of them, or replace one of them, or increasing the dose or decreasing the dose of one of them. While if he asks about the interaction here, he asks about what is the effect of one of them to the other. Let us read the choices. Reduce the dose of doxorubicin, increase the dose of doxorubicin, or replace glucosamine with another drug, or remain on the same dose. There is no interaction. So the expectation here that glucosamine will increase the level of doxorubicin, so increasing the cardiac toxicity for doxorubicin. What is the action? To know the action, you should ask yourself a question. The first question is, does both drugs are important or not? Does both drugs important or not? Can we stop one of them and replace it with another or not? Both are important, so we cannot replace any of them, so that we should go to the next step, which is control the dose of each of them or one of them. Firstly, glucosamine, here, it is a second line. It is an alternative to other drugs or adjunctive to other drugs in osteoarthritis. So it is not the important one to stick with. You can replace it with another drug. Okay, so the best answer here is to replace glucosamine with another drug. What is happened if this choice is not present? What will happen if this choice is not present? Decreasing the dose of doxorubicin or increasing the dose of doxorubicin? As I mentioned, glucosamine will increase the level of doxorubicin, so you should reduce it. This is the next choice if this is not happening. So the best choice or the most appropriate here is to replace glucosamine with another drug. Okay, this is the strategy to think about any question regarding to the interaction between two drugs. Let us see the next one. The structure of Zwitter ion. What is the meaning of Zwitter ion? Zwitter ion is the ion that contains positive charge and negative charge in the same time in the neutral media. So we called it Zwitter ion. Okay, so directly from those choices, we have this one, which contains positive ion and negative ion at the same time. So the answer is C. Which is not pyrimidine. As you know, purine and pyrimidine, they are the bases of DNA and RNA. This is the pyrimidine ring, and this is the purine ring. This is pyrimidine, and this is purine. Pyrimidine ring, we have three bases under this pyrimidine ring: thymine, uracil, which present in DNA or in RNA only. This is the DNA, and this is the RNA. Cytosine, which present in both DNA and RNA. While purine, we have adenine and guanine. Adenine will join with thymine in the DNA complementary strand or uracil in the RNA complementary strand, while guanine join with cytosine in the complementary strand, either DNA or RNA. So which is not pyrimidine? Here we have adenine. Which substance listed below that may not enhance the effect or the toxic effect of methotrexate? Also, is one of the recent exams, one of the questions of recent exams. Ethanol, trimethoprim sulfamethoxazole, cyclosporin, or salicylates. The answer here is ethanol. Ethanol have no effect or will not enhance the toxic effect of methotrexate. First generation antipsychotic primary mechanism of action. Take care here, we are talking about primary mechanism of action because antipsychotics have many or several mechanisms of action, ranging from dopamine antagonist effect or inhibiting dopamine neurotransmitter or serotonin or anticholinergic side anticholinergic effects or histaminergic effects. Okay, so the primary here affecting dopaminergic receptors or try to decrease dopamine level by inhibiting dopaminergic neurotransmission. We have two classes of the first generation. Okay. High potency and low potency. High potency, an example of it like haloperidol. Low potency, an example of it is thioridazine. The phenothiazines, thioridazine, and chlorpromazine. The compound shown below inhibit which of the following enzyme? If you don't know this ring, you can expect, or if you don't know the compound, you can expect. This ring is similar to the purine ring. What is the purine ring? This is the purine ring, but instead that the two N separated by one nitrogen, by one carbon, here they are adjacent to each other. The presence of double bond O make this drug similar to xanthine or xanthine oxidase enzyme. So the changing of the structure by this small change or little change may make it as an inhibitor to the enzyme. So it is inhibitor to xanthine oxidase. This is allopurinol. Allopurinol, which is xanthine oxidase enzyme inhibitor and used to decrease uric acid level in the blood. Fluoxetine does not need withdrawal because fluoxetine related to which group? It is one of the SSRIs. Those drugs used as an antidepressant agents, they will inhibit the serotonin uptake. So that increase, not decrease, increase the level of serotonin in the brain. If you stop this drug or those drugs under this group, suddenly you will have serotonin withdrawal syndrome. But one of them, which is fluoxetine, does not cause withdrawal. Why? Because it is of long duration of action. This long duration of action making it eliminated from the body gradually so that it will not cause the serotonin withdrawal syndrome. So the answer is it has the longest half-life, about 5 weeks. Let us see the next one. The antibody that is capable for crossing placenta. Here you should know the action of the antibodies very well. We have in our body 5 antibodies under the name of AMGAD or MAGAD. Antibody M or immunoglobulin M, A, G, E, D. Each of them having its specific function and its specific character. You should know every function of them. So the one that can cross the placenta, which is most common, and give immunity to newborn and present in internal body fluids, okay? Those are the characters of immunoglobulin G. Those are the characters of immunoglobulin G. So the answer is G. While M is the first antibody secreted in the body. The first line of attack. It is responsible for innate immunity, while G for adaptive immunity. E is the responsible for hypersensitivity reactions. Okay. Someone asked about the repetition of some questions. So let us do it after we finish. I repeat question number 9 and 15 again. For the first order kinetic, the half-life of the drug, is it dose dependent or dose independent? Is it increase as the dose increase, or decrease as the dose decrease, or decrease as the dose increase, or remain constant at any dose change? Let us understand the meaning of first order kinetics. Okay. Here we are discussing a drug that when we plot a relationship between dose and concentration of the drug in the blood, you'll find that as you increase the dose, the concentration of the drug in the blood will increase by linear relationship. So we called it linear kinetics. So take care. Here we don't talk about the elimination. Okay, the first order elimination. We are talking about first order kinetics. So we are talking about all parameters. This is the relationship between the dose and the concentration. As you increase the dose, the concentration will increase by a constant rate or linear relationship. Okay, here the parameters of pharmacokinetics, all parameters does not affected by the dose. all parameters are constant. Absorption is constant. Distribution, metabolism, and elimination, all of them are constant. So the T half is constant. Does not affect by the dose. So that you will find a constant T half for the drug. For example, any drug, give me any drug of the vast majority of the drugs. Like we mentioned fluoxetine from just 2 or 3 questions. Its half-life is 5 weeks. Okay? So it is constant. Whatever the dose, it is constant. It is follow the first order kinetics. So the right answer here will be remain constant at any dose change. Another type of question like this, they will ask about in linear pharmacokinetics, the T half is dose dependent, dose independent. It is dose independent. So here the T half is dose independent, or any parameter of the pharmacokinetics like volume of distribution or any of them are dose independent. Which drug against nausea is not used in pregnancy? Also, it is one of the confusing questions in previous exams. Pyridoxine, diphenhydramine, metoclopramide, or prochlorperazine. Okay. The confusion here comes from metoclopramide and prochlorperazine. Which of them is not used? You'll find that the right answer here is prochlorperazine. It is not used in pregnancy. It is one of the antipsychotic medication. Also, it is antiemetic agent, but not preferred in pregnancy because it may lead to serious side effects like extrapyramidal symptoms, neuroleptic malignant syndrome, and low blood pressure. And it is classified as pregnancy category C. Okay, its classification as category C in pregnancy. So this is the right answer of this question. Let us see the next one. Here, one of the calculation problems. It is related to the pharmacokinetic calculation. Here, I have a recommendation in any pharmacokinetic calculation. Firstly, you should know the formula very well. The formula should be known very well. Then the second thing is adjustment of the units. If you do those 2 things, you will solve any pharmacokinetic problems by an easy way in 1 step only. Any pharmacokinetic question, whatever is it, whatever the length of the statement of it, you will solve it in 1 step only. Okay, just put the information that you have, put the formula and adjust the units, then use the formula with the right units. Let us see this one. If the drug infusion rate, so here R is the infusion rate, is 750 milligram every 6 hours. And the clearance of the drug is, total clearance is 8.3 liter per hour. What is the steady state concentration? Okay. Steady state concentration here needed by which formula? Most of them are milligram per liter or gram per liter. Let us put it as milligram per liter. What is the formula that can be used to solve this one? Here we have a direct formula. CSS equal R over total clearance. So we just divide rate of infusion over the total clearance. But can we use those two figures directly? Can we divide 750 over 8.3? It will be wrong answer. Why wrong answer? Because the units are not similar. How? Here, the unit of infusion rate is milligram every 6 hours. So the unit of the time every 6 hours. While clearance rate is liter per hour every 1 hour. So we need to make this how many milligrams every 1 hour. Okay, so we have 750 every 6 hours. So every 1 hour, how many milligrams? It will be about 125 milligrams. What about the volume unit? Here we have liter and here we have liter, so there is no problem. And here we have milligram and milligram, so there is no problem. So directly we'll divide 125 over 8.3 to get 15.06 milligram per liter. Okay, this is how can you solve a question like this. Vitreous humor is present in, what is the vitreous humor? Vitreous humor is the solution that present in the posterior eye chamber. Okay, it is a clear gel-like substance that fill the space between the lens and the retina, okay, in the eye. It helps to maintain the shape of the eyeball and provide support to the retina and aids in transmission of light to the retina for the vision. So that here it is present in posterior eye chamber, while aqueous humor is present in the anterior eye chamber. This is the aqueous humor. Okay. The next question. MP is a patient of 60 years old with hypertension, is to be treated with beta blocker. Drug X and drug Y have the same mechanism of action, so they have the same pharmacological action. Drug X dose is 5 milligrams. Produce the same magnitude of antihypertensive action as 500 milligrams of drug Y. So this suggestion, drug X is about 100 times more potent than Y, or Y is 100 times more potent than X, or Y is less efficacious, or X is less efficacious. So the efficacy here are same. So we should exclude those two answers. While here the potency is the issue. Which is more potent? The lower dose is the most potent or more potent. So X here with 5 milligrams is more potent. Here 500 milligrams, so the relation is 100 times. The answer is A. Steady state concentration is achieved when? We achieve the steady state concentration when we have similar rates of absorption and elimination. If absorption equal elimination, we have the steady state concentration. The drug concentration in the blood will stay constant or approximately constant. So the answer A is the right answer. In moderate exercise, all happened except also this one from recent exams. Increase cardiac output, increase TPR. What is the TPR? It is temperature, pulse, respiration, decrease blood flow to the viscera, increase diastolic pressure. Okay, increase diastolic pressure. So what will happen here? Take care here, we are talking about moderate exercise. During the moderate exercise, the cardiovascular system undergoes various changes to meet the increased demand for oxygen and nutrients. These changes include increase in cardiac output. Okay, the amount of blood pumped by the heart per minute. This will be increased during the exercise to deliver more oxygen to the working muscles. Increase in heart rate, so the pulse will increase. Okay, to pump blood faster and meet increase in demand. Increase in systolic blood pressure. Okay, increase in systolic blood pressure. Redistribution of blood flow during the moderate exercise. This redistribution means the blood will go to the most important muscles that need oxygen and need blood. Okay, so it will be redistributed and decreased to the viscera. So this will happen. Okay, while the diastolic pressure may decrease slightly, not increased, due to widening of blood vessels or vasodilation in response to increased cardiac output. Therefore, the correct answer here is increase in diastolic blood pressure. This is the exception. Sorbitan monostearate. Generally, any salt of fatty acid, you can consider it as a surfactant or emulsifying agent used in emulsion. Sorbitan monostearate, commonly used in the production of emulsions. It has hydrophilic and lipophilic properties, HLP system, which allow to act as an emulsifier agent. It is important to note that the specific type of emulsion, oil in water or water in oil, formed by sorbitan monostearate depends on various factors, including the specific formulation and condition for use. Okay. However, it will most commonly used in water in oil emulsion. So this is the most right answer. Water in oil emulsion. It helps to stabilize oil drops within continuous water phase. The last question today. Which increase the risk of pyelonephritis? Pyelonephritis is the kidney infection in the kidney itself, mostly with the E. coli. Okay. Here we have many factors leads to pyelonephritis. One of the risk factors that increase the pyelonephritis is diabetes type 2. Diabetes type 2 increase the risk of pyelonephritis because it will weaken the immune system and impair the body ability to fight the infection. And this makes individuals with diabetes more susceptible to various infections, including urinary tract infection. And one of the urinary tract infection is pyelonephritis. Okay, this was the last question that we discuss today. Okay. I have one request about question number 9 and question number 15. So I can repeat them. Let me go to them again. Number 9. Yes. this one. Change of fungi from hyphae to yeast or opposite. This is the term of dimorphism. This is the definition of the dimorphism term. Okay, so the dimorphism means conversion from hyphae to yeast or yeast to hyphae. About question number 15. Yes, the first generation antipsychotics primary mechanism of action. Antipsychotics or the first generation have several mechanisms of action. For psychosis, we have high dopamine level and high serotonin level. So we need to decrease dopamine and we need to decrease serotonin. You'll find drugs used as an antipsychotics having an effect of dopamine. They will decrease or inhibit dopaminergic neurotransmitters or neurotransmission, also having an effect on serotonin. Plus, they have another effects like anticholinergic effect, antihistaminic effect, alpha adrenergic blocking activity. Okay? Those are the different mechanisms of action of the antipsychotics, especially the first generation. But the main mechanism that we use the antipsychotics for, it is inhibiting dopaminergic neurotransmitters. This is the first. While in the second generation, the inhibiting of serotonin neurotransmission. So if the question about second generation, we will choose the answer number B.
Please also the question number 6, if you can.
Question number 6. And after that, question number 24. Okay. Question number 6. Let's go to this question. Ion exchange resin. Ion exchange resin like cholestyramine, cholestyramine, and colocivilium, those agents will absorb other agents. Will absorb means will stick with other agents on their surface, so prevent their absorption. Therefore, we can use this idea or this criteria of the drug in many indications. One of them is lowering the level of LDL and cholesterol level. Why? Because they prevent reabsorption of bile acids, so that the body will feel that bile acid is not present and resynthesize bile acid from cholesterol. Therefore, it will consume cholesterol and decrease cholesterol level and LDL. Okay, so those are right answers: lowering LDL and prevent reabsorption of bile acid. Also, it will absorb other ions like potassium, so we can use it in hyperkalemia to prevent it. Also, we can use it in protection against toxicity from other agents, some agents. But the prevention of kidney stones is not one of the characters of ion exchange resin. One of them, or one of the important notes about ion exchange resin, it's interaction. If you use it with any other drug, you should make a separation between doses because it will decrease the absorption of the other drug, so that you should make a separation between doses. Okay. Question number 8, 9, and 24. Question number 8 here about furosemide and digoxin, the interaction between them. Furosemide will decrease potassium level by depletion of potassium or increasing its excretion, so that the relation between potassium and digoxin here, if you decrease potassium, digoxin toxicity will increase. So we should not combine them together. About question number 9, we mentioned it, we explained it, the hyphae and yeast, the conversion between them called dimorphism. About question number 24, let's go to it. the steady state concentration achieved when? When we achieve the steady state concentration. What is the meaning of this firstly? Steady state concentration is the concentration which is constant or approximately constant after several administration of the drug or chronic administration of the drug. We can reach this steady state concentration after 70 halves. We reach 100% of the steady state concentration after 70 halves. When this steady state concentration happens, if the absorption rate equal the excretion rate or elimination rate, so that the concentration of the drug will be stable. Okay, therefore the answer here is A.
So can you please explain question number 15?
Number 15. 15, we explained it. The first generation antipsychotics. Here, the first generation antipsychotics.
Okay, sir, got it. Thank you so much, sir.
Another question, number 7. Hypophosphatemia. It's an important question also. It's an important relationship that you should memorize very well. Relationship between phosphate and calcium. They are opposite to each other. One of them, if it is increased, the other will decrease because they will form a chelate with each other. Okay, so which will cause hypophosphatemia? It is hypercalcemia. It is the direct effect. Others, like vitamin D or parathyroid hormone or thyroid hormone, will cause hypophosphatemia. How? By their effect on calcium. Vitamin D and thyroid and parathyroid will increase calcium level in the blood, so leading to decreased phosphate level or leading to hypophosphatemia. But this is an indirect way. The direct way here is the calcium level. For potassium level will not affect calcium at all. Okay? I hope it was useful revision for all of you.
So what's the answer of this potassium level, D or A?
The phosphate level, hypophosphatemia, is A.
A.
Yes. Okay. Someone asking about the record of this lecture. You can follow the record from the, if you are not one of the members of our course, you can follow the record of this free one from the YouTube. Okay, YouTube channel. Also, if you want to join for the full revision, which contain the 4 lectures that I mentioned or announced about them, you can join this link, newptech.com course exam offer. You will join the full revision, which contain the 5 lectures plus the 4 main lectures of the revision, which contain revision for paper 1, paper 2, and mixed revision. And the 4th one will be the most recent records, the records of November 2023. Okay, either going to this link or contact with me directly to this number to help you in joining the full revision. The full revision also contains the mock test. It is included in the full revision if you want. Okay.
When they will be those full revision? When we will start them?
I will announce about the time. The coming one will be on Wednesday, the first revision for paper 1. Will
Those
be
for
on
revision to us who
Tuesday.
are just this for revision to us who are registered on the course
Yes, it
already
is
will have.
included. It is already, you have it already in your account. You have an account and you have it in your account. So go to your account to see the schedule. You will find the schedule in the first section in the curriculum. Okay, so you'll find which lecture will be the coming one. In Tuesday will be the English version, and Wednesday will be the Arabic version. Arabic one, yes. Okay. The coming free one will be, sorry, just, yes, the second free one will be on the Sunday, 11th of February. Not tomorrow, it will be the next week. Okay, this will be the second free lecture at the same time, 7 p.m. Sydney time. Okay. Finally,
Okay, thank you.
I would like to thank you so much about your attendance.
Thank you so much, sir.
I hope it was useful, and please provide me with
Thank you,
your feedback, and if you have any comments or any request for the next revision and so on. Thank you so much, and see you in the coming revision.
Thank you, sir.
Thank you.
Thank you.
Yes.